Hello, my name is Joe Carley, and I'm an addiction psychiatry fellow currently at the Mayo Clinic in Rochester, Minnesota, in the United States. And I've put together this review of approaches to opioid use disorder with the support of my mentor, Dr. Tyler Oesterle. And this article in particular is important to me with my experience prior to coming to fellowship. I had 3 years where I was working using medications for treating opioid use disorder. And that gave me a taste of the ability to really relieve suffering and make a significant difference in people's lives who are suffering from opioid use disorder. So altogether, I approached this article, try to make it very practical and accessible to general primary care or general psychiatry audience. So I really review just initially screening patients and engaging the patients in a compassionate and like motivational interviewing based way. And of course, I went through just reviewing the diagnosis, looking at the different levels of care that are available. And beyond there, I really tried to get into the nuts and bolts of what can be done if immediately there's concern for overdose or withdrawal risk, and then really getting further into the interventions themselves. So that really included primarily the medications, which I found buprenorphine to be the most accessible, but there's also important knowledge and application for naltrexone, as well as methadone. And as a complement to the pharmacotherapies, it is important to have some knowledge of the psychotherapies that complement medication treatment, as well as some of just recovery community peer support that is effective for many individuals. Finally, I acknowledge a few special populations that can be particularly difficult and may benefit from referral to further addiction specialists. Finally, I hope that this review is helpful and can be applied to relieve some additional suffering of the people struggling with opioid use disorder. Thank you so much.